Did you know that 32% of the Ugandans have mental illness, and yet majority of them don't receive the help that they are supposed to get? In today's video, we are going to learn more about how communities in Tororo District are learning about mental health, that it is real, help is available, and recovery is possible. So I'm going to show you some of the activities that I'm doing, and this is my second video that I'm doing. Not only based in the facility, but also reaching out to different communities, teaching them about mental illness, the causes, the treatment methods which are available. Majority of the communities in Africa have different beliefs about mental illness. They have misconception that mental illness is caused by witchcraft. Some of them, these people are locked in their houses. Some of these people are tied. Some of these people are taken to traditional healers where people are given different herbs. And so our mission is to ensure that we reach these communities with the mental health messages and teach the community leaders, teach the community members about mental illness so that we can reduce stigma in these communities, so that people can receive the care that they are supposed to receive. So in today's community, we are going to Bison A. It is found in Tororo municipality, Tororo district, which is found in eastern Uganda, and we want to continue also appreciating Heart for Families for helping us to organize for or mobilize for the community members. So in this this video, we see that we are able to see about 31 adults with the mental health messages, and our activity was a success. We are able to teach them about what is the meaning of mental illness, okay, and we also talked about them the mental illness. And one of the things that we told them and taught them about is many people think that a mentally sick person is a person who is moving on the rubbish pits, who is eating the things on the rubbish pits and fighting, doing it alone. But one of the things that I made them clear is to know that not all the mentally sick people are the ones who are moving. Someone can be smart but has a mental health issue. So we're able to tell them about that mental illness. We have different types of mental illness. We have different causes of mental illness, and these are many which are found within our communities. For example, substance abuse, it is too much in Tororo district. We have accidents can cause mental illness. We have genetics or mental illness can be transferred from one person to another. And also we talked about some of the misconceptions. Majority of these people believe that mental illness is caused by witchcraft. It can be transferred from one person to another. Some of these people don't want to associate with people who are having mental illness. So we are able to discuss with them the ways how to prevent the mental illness, like avoiding substance abuse, early treatment, seeking for support so that the recovery can be possible in the quickest time possible. We are able to engage with the religious leaders and the LOC ones or the local council ones. These are so much influential because when they speak, the people in the society are able to listen to them. And also the VHTs, those are the village health teams. Those are the people who know where these people are in the community, and we are able to identify some of them, and also we connected and exchanged the contacts, because in case of anything or psychiatric emergency in the community, they are able to send us these people. So we are able to meet and with the different age groups, the adults, the elderly, and we want to appreciate the mobilizers and even the community leaders who helped us to achieve this milestone. But one of the touching stories that I got the impact of of this activity is that I was touched by a story of a 17-year-old male. This one had he had a problem of epilepsy, and they had a lot of things at home. They went to different people in the society, and they went to the hospitals, but they went to the general practitioners. They sold most of their animals. They sold their cows, the property, the land. So when I met him, the man was so much miserable, and he had lost hope. When you could look at him, he had scars all over his right hand. It has scars because I think he got a seizure and fell in fire. But he tried to work to go for to do some work, like people with epilepsy, they can get an attack anywhere. So he was trying to do some work, like a vendor or a hawker who is moving with items, selling different items on the streets, but he could get attacks and falls down, and people come and take away the money that he has made. So when I met him, he shared with the story during the time of question and answer, and shared with me the story, and I realized the impact of this community mental health awareness, that many people are dying out there silently because they don't have the knowledge, they don't know where to seek the support. So we interacted with him, and his condition was not managed because most of the general health workers don't know how to manage people with mental illness. So they did all the CT scans, they did all the tests, but they could not refer this people to someone who is specialized in mental health, like me, because in Uganda we have a psychiatrist, but when you look at the ratio of a psychiatrist to the patients, is like one psychiatrist is equivalent to 1 million Ugandans, so which is not possible. And we have also psychiatric clinical officers, but who are handling these people in a district level. But you find that in one of our facilities, we don't have such kind of cadres. So these people can waste a lot of resources. They can go to the witch doctors, they can go to the general practitioners, and they waste a lot of money, and yet their condition could be just treated with just a little money or something simple. So when we met this young man, I think one day we shall bring him to our channel to testify of how he has now received the hope, because he had lost the hope that maybe there is no help. But now he has been able to receive that treatment. He's still undergoing treatment, and is recovering from the seizures. And this has continued to motivate me to move around the communities to teach them about mental illness, because there are so many people out there who are suffering. Imagine if we had not reached such a community to teach them about mental illness, we could not have found this young man. But after interaction, I had to invite him to the clinic, where I had to do my assessments, and I had to talk to him because he was affected psychologically, and he had lost hope of going back to school, but I encouraged him to go back to school. So he's now, next year in 2026, he's planning to go back to school, and he's now my friend. Yeah, most of the clients that I meet, I always make them my friend, so that we can share the stories. That the healing process can be quicker. So we continue sharing these messages. It was a success, and also we have seen improvement in health-seeking behavior. People are turning up to seek for help, and even people with different medical conditions are coming to the clinic for support, because they have received the knowledge. So the impact is really great. It is good for us to share these messages, but you find that most of the health workers, they don't have this motivation. People in the government facilities, some of them are demotivated. People are biased about mental health. So our communities are dying silently But our mission here is to ensure that the whole of our Tororo district, they can receive these mental health messages, so that people can understand what is mental health, what is mental illness, and how can it be treated, and where can we get this support. So our mission continues going on, though we have limited resources. We are very few people who are doing this activity. We are not having people who are supporting us with funds. We don't have the donors, but we are a team that is motivated to ensure that we can reach people with the mental health messages. Some of the challenges that we faced also during this activity, that we are interrupted with the rain. So, but thank God we had organized it near the church, so we had to enter into the church, where Dr. Bale had to continue from where I'd stopped. Dr. Bale is a medical officer who is operating Dr. Bale Medical Clinic, where I'm offering the private mental health services. So he was able to continue and also teach the people about the general medical conditions. Okay, sometimes the general medical conditions can cause mental illness. For example, someone with hypertension, diabetes, if the sugars are high, they can lead to mental illness. They can cause people to start talking unquoted things. So our mission is to reach the whole of the district with their messages. It is not an easy task, because we need a lot of resources. We need money for transport. We need also food to eat. We need various things that we can do. We need to money to pay our mobilizers, like people to mobilizing for us. We need to clear them, like the VHTs. They are good in mobilizing. The LOC ones, that one motivates them to organize for us a good number of community members, so that they can turn up for the messages. But as a mental health expert or as a psychiatric clinical officer, I am really motivated, and my goal is to ensure that we reach these communities, so that we don't see people who are suffering silently. We don't want to see our community suffering like this. Many people are biased about it, but I am not biased about it. I am motivated to move. So those who are watching, if you are still new to this channel, we request you to subscribe, like, comment, and share with your social network, so that they can get these messages and they can see the impact of what it means to reach the villages. Okay, so I would love to appreciate if you like what we are doing. You can still support us. You can support us by liking, by subscribing, and this motivates us to continue doing what we are doing. We are bringing hope to the people who had lost hope, and just like as I've shared with that 17-year-old is now having hope. But if we would not have taken that initiative to reach out to that individual, then that individual's life would have stopped there, because he had dropped out of school. Now the family is struggling financially, but these messages has encouraged them, and we are seeing people getting help. And in our next video, we are going to go to Bison. Again, Bison has different villages. There is Bison A, there is Bison B, there is Bison C. For this particular activity, we're in Bison A. So our next activity is we are going to Bison C, sometimes called Juba. That is within Tororo municipality. The municipality is really big, and when we look at Tororo district, is quite big, and we have different health facilities. We have Tororo General Hospital, which is serving different districts. Those of Manafa, serving people from Marava, Kenya, people from Busia. We have people from the places of Mbale, people from Bujiri, people from Tareja, and there's a lot of substance abuse within the district, and even the surrounding region. So there is a lot of workload for the health workers, and we don't have specialists in our facilities. That is one of the worrying things. And
people are dying silently, but with these messages, we are able to reach and support these communities. So let us continue watching and supporting these activities. So thank you so much for listening, and I hope to see you in my next video. If you are new to the channel, I request you to subscribe, because it encourages me to make more of these videos, to see the impact what these things are doing. And my name is Virav Enoch Francis. I am a psychiatric clinical officer. I am trained to manage people with different mental health issues, and I've been doing this in the refugee camp. I've been in the Chivale refugee settlement that is found in southwestern Uganda, where I've been managing people with depression, people with post-traumatic stress disorder, which is due to the sexual violence and abuse. You know, in Chivale there are so many refugees from the camps. That is the refugees from Congo, Somalia, Burundi, people from Rwanda. So I bring that experience here in the land of Tororo. It is a lovely place, and it is known for the industries. But my concern as a mental health specialist, to see that we have at least a hospital which is can offer mental health services, so that we can avoid our people being referred to the National Referral Hospital, which is also overcrowded. So thank you so much for listening. See you in my next video.